Why is chronic fatigue so hard to explain? Imagine feeling exhausted all the time, yet looking perfectly fine on the outside. That's what makes chronic fatigue such a tricky symptom to understand. It's not just feeling tired after a long day, it's a deep, persistent exhaustion that doesn't go away with rest. This kind of fatigue is highly personal and hard to put into words because everyone experiences it differently. Some describe it as a heavy weight on their body, while others say it's like their energy has been drained completely. Because it's subjective, it's tough for doctors and loved ones to really grasp what someone is going through unless they've experienced it themselves. The complexity doesn't stop there. The biological processes behind chronic fatigue are incredibly intricate. When it comes to neurological conditions or brain health, fatigue involves many factors working together. For example, brain tumors can interfere with the normal functioning of neurotransmitters, which are chemicals that help brain cells communicate. This disruption can affect energy levels, mood, and thinking skills. Plus, inflammation and immune system issues play a big role. When the immune system is overactive or dysregulated, it produces substances called cytokines that can make you feel tired and sluggish. These immune responses consume a lot of energy, leaving the person feeling drained. Scientists have also found that fatigue can change how different parts of the brain connect and communicate. Using advanced imaging techniques like magnetic resonance imaging, researchers see that fatigue affects brain networks involved in effort and decision-making. These changes develop over weeks or months, making the fatigue feel even more persistent and hard to explain. It's not just a simple feeling of being tired. It's a complex shift in brain function that's difficult to measure with standard tests. Chronic fatigue rarely exists alone. It often comes with other symptoms like weakness, pain, sleep problems, depression, and brain fog. This combination makes it even harder to pinpoint fatigue as a standalone issue. For people with cancer or those undergoing treatment, fatigue is described as a distressing, ongoing sense of physical, emotional, and mental exhaustion. It's not just feeling sleepy, it's a multidimensional experience that affects every part of life. Because of this, explaining fatigue becomes a challenge. It's not just about needing more sleep but about understanding a whole network of interconnected symptoms. Another reason it's so hard to explain is that fatigue is invisible. Unlike a visible scar or hair loss, fatigue leaves no outward signs. Someone may look healthy but feel completely depleted inside. This disconnect can make it difficult for others to understand the severity of what's happening. Patients often struggle to communicate their experience because others can't see their exhaustion, which can lead to misunderstandings or feelings of frustration. Adding to the challenge is the lack of a universal way to measure fatigue objectively. Doctors relying on patient self-reports, but there's no single test that can quantify how tired someone feels. Different people rate their fatigue differently, and even the same person might feel more tired at certain times of the day or week. This variability makes it hard to track and explain fatigue consistently, which complicates treatment and management. Recent research shows that fatigue can even influence survival in some brain conditions like high-grade gliomas, a type of brain tumor. This highlights how serious and complex fatigue really is. Yet, despite its importance, there's still so much we don't fully understand about why it happens or how to treat it effectively. Treatments often help with underlying issues but rarely eliminate fatigue completely. It's frustrating because it persists despite medications and therapies, leaving patients feeling helpless and misunderstood. In the end, explaining chronic fatigue is challenging because it involves many layers: biological, neurological, immune, and psychological. It's a deeply personal experience that can't be fully captured by words or simple tests. Its invisible nature, complex mechanisms, and resistance to straightforward treatment make it one of the most difficult symptoms to communicate and manage. If you're experiencing persistent fatigue, it's always best to talk with a healthcare professional who can help explore the underlying causes and develop a personalized plan for managing it safely and effectively.